Good day, everyone. Happy new month and happy independence. Today is another day with your fertility specialist. My name is Gift Ameve Afiru, and I'll be your humble host for today. For our returning viewers, thank you for being consistent with us, and thank you for being with us on behalf of Alps Hospital. Thank you for joining us. Today, we have a very important person in our midst that we're going to talk about certain things, and she's going to share knowledge for with us. She doesn't need much introduction. She's one of the best consultant gynecologists. She's a minimal access surgeon and she's a fertility expert. When I tell you we're in the midst of royalty, I mean we are in the midst of royalty. I'm presenting to you Dr. Jane Ojiani. Dr. Jane Ojiani, good afternoon.
Good afternoon,
How are
Gifts.
you doing
Very
today?
well, thank you. And how are you?
I'm very well, thank you, ma. So we have a very interesting topic today: fibroids and fertility. When I was growing up, when I hear the word fibroid, most women put it together. When you hear fibroid, they think infertility. So fibroid and infertility in the same sentence is kind of strange to some people. So we'll just delve into it now. The first question I would have for you is, what exactly are fibroids and how common are they among women in productive age?
Yeah. Well, fibroids generally they're just non-cancerous growth found in the uterus of women,
Yes, ma'am.
or will I say the womb of women. It grows within the muscles of the uterus. They are not cancerous,
Serious.
though even there's a slight chance of something very little, as less than 0.1, can be cancerous, but generally they are not. They are really non-cancer and they are very common, very very common. The fact that especially among the black race, women in the sub-Saharan black women generally, our genes increase your chances for having fiber. In fact, if you do a scan, an ultrasound scan for about 10 women, you will likely find fibroids in up to 7 of them. Now, the difference is in the size, location, complications, and all of that. But a lot of women live with fibroids without any problem.
Okay. You mentioned a very little percentage of it being cancerous. Are there instances where what will lead to it being cancerous?
Well, not significant. It's just, when you have those growth, they can have some changes.
Oh, okay.
Some of those fibroids begin to accumulate water, what we call cystic changes, but those are very big terms. So when we have that cancerous change too, we have a very small fraction of people that would have that, but it's something at the extreme, very end, last part of the changes of
Okay.
fibroids. It's not a very common finding, but it could happen. So people need to know that there's an opportunity for it to happen.
Okay. Ma, can you please explain the different types of fibroids we have?
Well, fibroids, I would not say different types per se, but maybe we would classify them based on location.
Okay.
So, the uterus or the womb, as we would say, has different layers. It has the outer covering, it has the muscle part of the womb, and then we now have the lining of the womb.
Yes, ma'am.
Now, fibroids can sit in any part of this, and you can have those sitting just within the lining, within the uterus itself, within the womb. Those ones are called, like, what we call they're in the cavity of the womb. Then we have those that sit just underneath the lining of the womb. Those ones too are notorious for heavy menstruation. Your bleeding is very, because it increases the area where the surface area of the lining of the womb. You also have those in the muscles, those we call intramural. They can cause heavy bleeding. They can cause painful menstruation. And finally, we have those that just sit outside the body of the uterus, what we call subserous fibroids. Those ones are notorious for causing pain. But we can have other extreme forms, what we call parasitic fibroids. They are just not on the uterus, but they are just hanging
Yeah,
somewhere
yeah.
around. Yes. Then basically, those are the kinds of fibroids you can have, and the location of the fibroids actually gives an inkling or something to the kind of pain or the complication the patient or the client would present with. So basically, those are fibroids.
Okay. Thank you, ma. So what are the obvious signs that women should watch out for? so that when they see this, they'll be like, okay, I have fibroid. Let me go in to see a doctor. What are the obvious signs that are there?
Well, any you see for most of the signs or the symptoms that women would have for fibroids, they could have that from other conditions. So when you see them, doesn't mean fibroid. It could be. So commonly, we'll have women with heavy menstrual bleeding. You see a woman that normally would menstruate for 3 days. Now her period has increased from 3 to almost 8 days, and the amount of or the number of sanitary towels she uses in a day. Normally, she would use three. Now she's using close to a pack in a day. Or she would tell you the bleeding is so heavy that they now use diapers. Then you know you suspect that it could be a fibroid causing that, but there could be other causes. So evaluation is key. Assessment is key. Then another common symptoms that women would have with fibroid is increasing size of their tummy. They'll begin to feel something growing in their tummy. Some would even mistake that for, they'll assume it's pregnancy. But when they do a scan and all of that, you pick the fibroids. Then some will also come with this recurrent pain down the abdomen. When you have that, or lower down their bellies, when you have those, sometimes you need to check with your gynecologist. It could be a fibroid sitting in there that can
Oh,
be
okay.
dealt with and life returns to normal.
Yes, ma. All right, thank you so much, ma. So, how can fibroid affect a woman's ability to conceive naturally?
Okay, so yeah, so we would have to say this first, that fibroids can affect a woman's chances of achieving pregnancy,
Yes, ma'am.
and also a woman can have fibroids and have all her children. Yeah, so but for some women, the location of fibroid. So you can have fibroid sitting just at the entrance of the womb, where just sitting just at the head, the cervix there. So it can prevent the sperm from getting up to the uterus or the womb, up to the eggs for fertilization. You can also have fibroids at the point occluding the fallopian tubes. It means that the sperm cells cannot swim to the eggs for fertilization. Then you can have women that are having chronic pain that can affect their um, intimacy, sexual life, and with reduced frequency of sexual intercourse, chances of conception significantly reduces. The fibroids alone can cause other things, like you can also get pregnant, can cause recurrent miscarriages. So all of those. So now you have gone past not getting pregnant, then you get pregnant, but because of the fibroids location and all of
Yeah.
that, retain the pregnancy, it becomes a problem. Recurring miscarriages can make your babies lie in abnormal position, can make women bleed in pregnancy, and a whole lot. But commonly, location will determine some of the complications that would arise with fibroids.
Okay. Thank you very much, ma, for that.
You're welcome.
Do fibroids increase the chances of a cesarean section?
Well, I would say yes and no.
Mm-hmm.
Now, again, we still have to go back to location.
All
Now,
right.
for labor, for a woman to have her baby come out from her womb, the cervix, or what we call the mouth of the womb, has to open. Now, if you have a fibroid sitting just on that cervix, down the point that is supposed to open for the baby to come, it will not make the labor effective. The opening might not occur. It means the baby would not descend and vaginal birth would not be achieved. With fibroids sitting in the muscles of the womb, it can affect the consistency of uterine contractions. And when women have these incoordinate contractions, their labor might not be effective. So you might not have what we call failure to progress in labor. Then basically those are the things that can affect. Then even the location of fibroids can affect the descent of the head of the baby and all of that. When we put all of those together, sometimes when you have all those factors, you want to counsel a woman for a cesarean section, because on table two you can see the issues. Because even with fibroids you can have another thing that can increase their chance of cesarean. So with fibroids you can have babies lying in abnormal positions, what we call abnormal lie. We can have the placenta sitting in the wrong place, like in down the uterus, where is the wrong position. So all of those increase, because once you have placenta sitting there, it means your delivery will be by cesarean section. So all of this put together will increase your chance of cesarean section. But a few women would have their babies with a fibroid. So long as it's sitting up in the uterus, it's not affecting contractions, yes, they could have vaginal birth.
Okay. Thank you, ma. That was very insightful. So, my at what point do a woman with fibroid seek fertility advice and fertility treatment? At what point?
Well, a woman having fertility challenges could be from a lot of causes. It doesn't have to be the fibroid. As we have established that women with fibroids can have all their
Oh,
children without any problem.
yes, ma'am.
But when a woman starts trying to achieve conception, you when you see your gynecologist, all the problems associated with your infertility or what the possible cause of your infertility will be laid on the table. Then you now discuss them one after the other. So most times people don't just come because they have fibroids, they think it's the cause of their infertility. But oftentimes when you're evaluating women, you look out for all the causes generally, their hormones are fine, they menstruate regularly and all of that. Then you see a fibroid because fibroids have a way of keeping the uterus in a continuous state of what we call the kind of contractions, or I don't know, for lack of a better word. So you when you see all of those, you counsel the woman appropriately. So you have to put every other thing together, not just because of a fibroid, then you think the infertility is from that fibroid.
Okay. Thank you so much, ma'am. How do procedures like myomectomy affect future fertility?
Well, okay, myomectomy is generally they are called fibroid removal surgeries,
Yes, ma'am.
and they can affect fertility. First, they are very bloody surgeries, and because of those cuts made on the uterus, they increase risk for what we call adhesions. Adhesions means the organs healing on themselves. So when you have that following a fibroid surgery and there's increased healing of organs on themselves, the fallopian tube can heal maybe posteriorly on the line on the body of the womb or something. So that can affect the swimming and the picking of the eggs for conception. Then, if you have fibroids that are sitting just below the lining of the womb, by the time you take out those fibroids, you can cause what we call a breach of the lining of the womb. And most times, when it's repaired, they can now heal with scars within the lining of the womb, which can affect the woman's will give symptoms like reduced menstrual flow and also affect their chances of conception. So fibroid surgery can actually increase risk of can give some complications of what we call intrauterine adhesions, which can affect conception.
Okay. Thank you so much, ma. What are the best methods of diagnosing fibroids for women that are trying to conceive?
Well, fibroids are basically picked on ultrasound scan. And so that's the commonest method you pick it. And then when you want to go for surgery, sometimes for medical and legal cases, what we call medical legal reasons, you would ask them to go for what we call HSG to help line their tubes because I'd explained that fibroids can increase adhesions and block some organs. So you want to make sure that their tubes are patent even before your surgery because someone might have a blocked tube, but assume it's your surgery that caused the blocked tube. So you need to do what we call hysterosalpingography. That's lining of the tubes, confirm patency of the tubes.
All right. Thank you so much, ma. How can fibroids affect early pregnancy?
Well, fibroids generally will affect early pregnancy. As we said, can cause increased risk for miscarriages. Fibroids sitting just underneath the lining of the womb would cause difficulties or problems with implantation. Implantation, like the baby or the embryo sitting or burrowing properly into the womb. So that can cause miscarriages. Then they can have what we call pain because of reduced blood supply to the fibroid itself. Because the womb has now has been diverted to the growing embryo, what we call red degeneration. But they can just have pain in pregnancy, and that will bring a lot of discomfort and some a lot of discomfort to your client here.
Okay. Thank you, ma. So, there are women that are not, for lack of a better word, I would say, are not aware of certain things that you have said now. And then when they, as I said earlier, when they hear the word fibroid, they are just scared. How do you help a woman when a woman that does is not aware of what fibroid is? And how do you help her emotionally? Try to explain it to her. How do you lead her stage to stage to help her understand better?
Well, basically, is what we do, right? You
Yes, ma'am.
try to explain the problem, right? Let them know the severity or how severe their problem is. So you have a fibroid that is so small, two measuring maybe 2 by 2 centimeters. You tell the client that this is not so big, but it depends on what you want to achieve. Then you explain, depending on what you want to achieve for that client, that determines what you tell the patient. So you carry them through the treatment options available, what can be done, fertility options after treatment. So the discussion is patients, it's per patient. So I see
Okay.
this client, I explain. The next one, what I'm going to tell you about your fibroid. And you know, the size of the fibroid also determines what you do.
Okay. So, ma, is there a particular age that's come to you that they have fibroids, or it just happen? Are there teenagers that have ever come to you before that have fibroids, or is maybe older than that?
Well, fibroids commonly are growth that you see in women within what we call reproductive age. And reproductive age is assumed to be from 15 years to 49. And these fibroids, because of the hormones of menstruation, help them to grow. So you see them in young women in their reproductive ages. So I've seen fibroids across all age groups. So no age group is
Yes,
exempted.
I'm dead. All right. Thank you, ma. Thank you very much. What treatment options are available?
For fibroid surgery.
Yes, ma'am.
Well, or fibroids generally.
Yes,
Well,
ma'am.
fibroids, you have what we call do nothing, what we call conservative. Then we also have what we call medical treatment for fibroids. Then we have surgical options of management or treatment. So for some that don't have any symptoms, like I told you from the introduction, we have a lot of women working with fibroids,
Fibroids.
but they have no problem. So they are not in the hospital and they have not had a scan. The doctor has not said, see one, they're looking
And
at
there is
you,
no obvious
no
sign.
obvious signs. So there is no vaccine, so you let them be. Then there are some that have symptoms not ready for surgery. We have medical things. We can give them drugs, we can give them hormones, we can also cause what we call medical menopause for them temporarily. Remember I said the hormones of menstruation helps these fibroids to grow. Then we also have surgeries where we take our fibroids or basically take out fibroids. Then for some women who have completed their family size and don't intend to have more babies, the option of removal of the uterus is also there.
All right.
Because so long as the uterus is there, there's a risk of recurrence of the fibroids.
Okay. All right. Thank you very much, ma'am.
You're welcome, gifts.
All right, thank you very much, ma. What you have shared has been very insightful thus far. I have really learnt a lot. So I have another question I would like to ask you, ma. Can fibroids cause permanent infertility?
Fibroids. Well, fibroids cannot cause permanent infertility. Remember, we have said they can be taken out, they can be treated. So it means wherever location they are, they can be taken out. And a woman can conceive so long as the surgery is well done. And
Mm,
after surgery, sometimes just look into the womb with a hysteroscope. So long as the line of the womb is fine, then the woman is good to go with her pregnancy journey.
okay, so there's no cause for alarm.
No cause for alarm.
All right.
Fibroids are treatable, manageable with return to good quality of life.
Okay. All right, ma. So there's a viewer of ours that is asking, what is the best treatment option available for a woman who is seeking to get pregnant?
Well, for the best treatment available for a woman seeking to get pregnant, definitely will be removal of the fibroid. Well, but again, she needs to be evaluated. We need to know the size of the fibroid, location of fibroids, and all of that. Because, but then removal of fibroid would go a long way to improving and also increasing the retention of the pregnancy eventually when it happens.
Okay. All right. I'm pretty sure she's well understood now from all you have shared. You have actually shared a lot today. Dr. Jane, thank you for sharing this knowledge with us. I mean, we've learned a lot. I mean, the viewers too can testify that they've learned a lot. When I said we are in the midst of royalty, I actually meant it, and this is evident. So, okay, I think that will be all for the questions that viewers are asking. Thank you once again, Dr. Jane Ojani, on behalf of Apps Hospital. Thank you for joining us today. We
You're
really
welcome.
appreciate viewers. Thank you for joining us. Thank you. I'm very sure you got a lot today because I am very sure I got a lot too. Thank you for joining us. We'll see you next time. Thank you.